Hello, everybody. Can you hear me now?
Yes,
You can hear now, right? That's all. We will start at 6 o'clock. Perfect. Okay. Hello, everybody. Assalamu alaikum. Good evening, good night, wherever you are online from. And I see a lot of people joining us. My name is Dr. Shazia Mqsood, and I'm the course director for the membership exams for the RCPI and RCOG for the Med Exam Expert. You're all very welcome to our March 2025 batch introductory session today, introductory webinar today for the MRCPI Part 2 written. So I would like to know, how many of you have decided to appear in the March 2025 exam, and what are your plans, and how did your part one go? Did you finish your part one recently? How long has it been since you finished your part one? So you can all type in the chat, and let's begin informally. All righty. Okay, we have just finished our MRCPI Part 2 course last month with excellent results. And I am going to run a small video for you as we are starting, and I'll keep on reading the chat as well at the same time. Hello, Amna. Assalamu alaikum. Inshallah, you're going to be passed this time around, and we have got a lot of stories to share with you, lots of tips and tricks to share with you, Dr. Amna, and inshallah, you will be successful this time around. And so here are some success stories that we will share for you. Dr. Reem, hi, assalamu alaikum. Just finished your MRCOG 1. We'll go for MRCPI Part 2 directly this time. You missed because of 2%. I'm sorry to hear that, Amy, and inshallah this time around we will work harder with you and make sure that you pass this exam when you join us. And Dr. Reem, you're very welcome on board. Just follow us through the end till the end of the webinar and see if this course is appropriate for you. Now, also, let's see what other topics we have to cover today. Just bear with me for 1 second. All right, have a look at this video first, and then we will talk. So we have top scorers, and we have so many people passing: Dr. Arbaba, Dr. Komal Rafe, Dr. Sidra Malik. I think we had 2 Sidras this time around. Dr. Afaf Al-Amro, Dr. Munazza Usman, Dr. Nazia Malik, Dr. Faria Mumtaz, and 73% for Dr. Faria, 69% for Dr. Nazia, 73%. And that's their testimonials for us. Just so that you have an idea, what way we worked around with everybody. 69% for Dr. Komal, Dr. Halima, Dr. Sidra Asif, the other Sidra, 69%, 73% for Faria Mumtaz. Everybody did exceptionally well. 80% for Dr. Arbaba, mashallah. So she did first in our MRCPI Part 2 group, and 76%, and then 73%. So we are very happy to announce our second course for the MRCPI Part 2 written. This is in preparation for the 25th March batch. And for those of you who are taking the MRCOG route or who are directly appearing for the exam after passing the MRCPI Part 1, you're all very welcome. Today, we are going to talk about all about MRCPI-2, all about your journey for MRCPI. I'll take a lot of questions in the chat as well. Feel free to ask me as many questions as you would like. My background is OB-GYN for the last 30 years. And I am a training program director for Saudi residency training in Saudi Arabia in Riyadh. And also I am an examiner and an exam convener for MRCPI Part 3 exams in Saudi Arabia. Also, I'm an examiner for the MRCOG and course convener for the MRCOG as well. Why MRCOG, you might want to ask, because it would definitely fast track your medical career. And the most important thing is it's an addition of an international degree to your already accoladed curriculum vitae. And what we want you to do is to make sure that you pass in the best possible way possible. And most of you, when you're joining our course, or when you're thinking of joining the course or thinking of taking an exam or whatever exam in life, you will always ask yourself, will I be able to do it? Can I be the one passing the MRCPI? What if I do not pass? There are so many questions. And first of all, we need to make ourselves understand what adult learning is all about. Why are we sitting for this exam? It's an international qualification. It is recognized worldwide. Wherever you're going to drop in your CV with an MRCPI degree, you're going to be considered A, for the job, as well as B, for a better, higher tier for your salaries as well. Apart from that, it also trains us to be safe and efficient at work, because going through all the clinical practice guidelines and going through all the scientific research papers, how to modulate our answers, we are able to modulate our management plan efficiently and safely for our patients as well. So let's work together. If you join us, we are going to do live sessions. I am going to take your live sessions online, and we are going to talk about Irish and HSE summaries and guidelines, slightly different from the RCOG guidelines. But whenever we are talking about your syllabus, whenever we are talking about the plenary for the short course, long course, we talk about teaching you everything and the slightest possible of differences as well. We also do session recordings for you. We give you PDFs and video recordings. We go through all the talk guidelines, the NICE guidelines, the FSRH guidelines, all the guideline summaries, all the flashcard, all the scientific impact paper. These are the parts. Then we do questions which are pool-based. All the single best choice answers will be pool-based, and which will be based on all the guidelines. So we have a separate SBA only group where you will be doing these mocks every day, at least 40 to 50 questions every day, and then we publish their answers at the end of the day as well. So it's basically an exam preparation that we are offering you, which is not only Irish-based focus, but also in terms of a 24-hour faculty support that we will give you. And we will also talk about a one-on-one preparation and a pre-exam cash revision and moral booster sessions as well. The most important thing is this is a recall crash workshop that we did for 3 days for our previous batch, of which the results you have seen are so promising. All of our candidates passed. And 23, 24, and 25th of August, we ran almost about, I believe, on a daily basis, we were doing 700, 600 SBAs. It was a live session for about 3 to 4 hours for 3 to 4 hours each day for 3 consecutive days. So that everybody found very, very helpful, because these were the recall workshops. So your examination format, a little bit about your examination format. It's a one paper. It's 100 single best answers, and it's a 3 hours paper online. And today's webinar is all about how can you apply, when are you planning to apply, how do you go about on the Irish College website. And so you are, and because there is no negative marking, very, very importantly, unlike your medical schools, so therefore you're strongly advised to answer every question. And we will make you prepare and revise and revise and revise so many times that there'll be most of the SBAs will be something that you'll be already familiar of, and you'll attempt them very fast. So most of our candidates gave us the feedback that, we were able to be very fast in the exam because we already knew the answers. All right. So these are some of the entry requirements. One of you did tell me today that she passed her MRCOG one, and then she's eligible to apply. The other one said that she has passed her MRCPI part 1. So anyhow, the candidates, your part 2 eligibility is on the website for the RCPI. You have to achieve one of the required part 1 or equivalent listed qualification. And additionally, you should have completed 18 months of post-registration training, 9 months in obstetrics and 9 months in gynecology. Walaikum assalam, Dr. Ghazala, how are you, my dear? And you must pass after that, you must pass the part 2 obstetrics and gynecology written examination before applying to enter the part 2 OSCE or clinical exam. So there are 2 parts. One is the written and one is the OSCE one. All righty. Now, let's see. Bear with me for a second. So again, for part 2 written, you have maximum 6 number of attempt, and the time limit to pass is 6 years. After passing the part 2 written, you have 6 attempts for part 2 OSCE, and you have 3 years time limit to pass. But hey, we are not going to last that long. We are going to get all the exams in the first go. And that is our motto at the Med Exam Expert, that we make you train, and we train you more scientifically and more exam oriented rather than anything else. All right. So these are the equivalent qualifications. If you're from the UK MRCOG line, you need to pass your Part 1, and then exemption from MRCOG Part 1 is not acceptable. And then in Ireland, if you have done the RCPI Professional Diploma in Obstetrics and Gynecology, or you have passed MRCPI Part 1 in General Medicine, Pediatrics, or OB-GYN in the last 6 years. From Pakistan, FCPS is recognized. From Australia, MRA-COG is recognized. From New Zealand, MRNZ-COG is recognized. From South Africa, FCOG. And from Malaysia, MED in OB-GYN is recognized qualifications to apply for this Part 2 written exam for the Royal College. Okay, so these are your exam dates. And these are your opening dates and closing dates and the exam fee, etc. Let us get into the nitty-gritty of that. So the first date is the examination date is 6th of March. That's a Thursday. It is an online remote invigilation. So you will be asked to download a certain website, and we'll talk about that. And then the opening date, keep an eye on the college website, register your interest, make an account on the college. So the opening date would be Wednesday, 4th of December. And then you've got plenty of time because it will be open for almost more than a month, and it will close at 5 p.m. Irish time, 8 January 2025. That's a Wednesday. Okay. And how to apply? These are submitted through the RCPI website. You'll be prompted to include some documentation if you're applying for the first time. If you are repeating the exam, you're not required to apply any documentation. And you make the payment as required for the examination. So keep a credit card handy as well. And then if you are going after the closing date, of course, your application will not be accepted. So what we did for the last batch was that we sat with them from the opening date to the closing date, and we helped them, finish all their paperwork in time to apply. So you have to have attested copies of your primary medical degree. Is it an MBBS degree, an MD degree, whatever, it has to be attested. It can be attested by your college principal or from your college, or it can be attested by any notary public from the legal aid. Then we need a copy of your Part 1 or equivalent class qualification. This does not need to be attested. If you have had your MRCOG Part 1, we will also need to put your official Part 1 pass letter with that. And for your FCPS and other qualifications, you will need to give the official diploma paper as well. So it's a good idea that if you have decided to apply before the offer opens in December, you've got the whole of November to collect all these documents. Please feel free to ask me any questions about these documents. The most important thing is put them in a PDF, put them in a single PDF folder, and then you can apply it online through that PDF as well. You will also need a testimonial form completed and signed by 2 referees, and you will need a passport-sized photo, which is a colored full face, 100 by 100 pixels with a neutral background. This is a testimonial form by the RCPI, and it contains names and addresses of 2 members of RCPI, and it will contain your full printed name in capital letter in the center, and at the bottom, the referee number 1 and referee number 2 will sign for you. All right, so, and in terms of examination format, it's 1 paper. As I said before, it's 100 single best answers. It's a 3-hour question. There is no negative marking, so please do answer all the questions. Now, your primary degree can be attested by your university or your medical school, a solicitor or a notary public lawyer. If you're in Ireland, you can go to the Irish police station and get it sorted by Garda Síochána, or an Irish or a British consulate, whichever feels feasible for you, you can get your primary degree attested, okay? If it is attested at the back, then you need to show the front and back of both the degrees in your PDF as well. Please remember that. Now, this is the remote invigilation. You can give the exam in the comfort of your own house. You don't need to go to any center, but you will be supervised remotely by invigilators and supervisors throughout the exam. This is the website. This is called Test Reach, and it is an assessment online. And when you are given a place in the exam, you will also be sent an email separately for how to log into the Test Reach, how to check if all your computer system functions are working and are reliably connecting to the test reach for the day. And the first email, you'll be emailed by test reach approximately 10 days in advance of your exam date. Your login credentials and instructions will be given to download the application. And there will be a second email where you will be notified that you have been assigned to whatever time of the examination. And there will be login instructions to the application, how to test your device, how to test your webcam, microphone, and speakers. You're asked to sit in a quiet room with a neutral background, with no noises, no children, no animals in the background, no people roaming around in the background. So it has to be a quiet room. So that is very important that you arrange for that. You will also be asked to book a time slot to start your examination. So there are different time slots, morning 3 hours or late afternoon 3 hours or late afternoon 3 hours, okay? And then the most important thing is that the start time of the examination will be based on your location and time settings on your device. So that email will contain, when you will open the test reach, once you have logged in and registered, it will show you the time your exam will be done. So complete all these steps at least 3 days before the exam, or you will not be able to start the exam on the day, all right? And then you'll be instructed to log in into the exam application at least 15 minutes ahead of time on the exam date. And then an invigilator and supervisor will guide you to complete the pre-validation process, because you will keep a proof of identity like a driver's license or a passport or a residence permit card, whatever you have, before the beginning of the examination. So again, if you log in late or if you arrive late, you won't be permitted to enter the exam. So be very mindful about punctuality. So you will need, please do not give this exam on your smartphone. You will need a PC or a laptop with a reliable internet Wi-Fi connection. This time around, we had some internet glitches in Pakistan, and the college was aware of that. And they did provide the candidates from Pakistan, which were about, I was told that there were at least 100 candidates appearing from at one point in time from Pakistan. So they knew that there was a glitch and they were ready for that, but nothing happened and the exam went smooth. So you must be able to install software and meet the system requirement as set out by the exam provider. And multiple screens are not permitted because the invigilator will ask you to move the camera around and show the room as well. And it should be a single occupancy room, as I told before. There should be nobody else present in the room. You should be alone in your room. And there should be no recording equipment other than your own webcam in the room. And you should not be disturbed during the examination by knock on the door or any people or any animals or any children. This is how your exam screen will look like. You'll be able to see your photograph. There'll be messaging at the bottom between you and the invigilator, and there'll be questions on the top right, and there'll be answers and actions at the bottom. So this is what your screen is going to look like in the actual exam, darlings. Any questions so far? There are quite a few people in the participants. Let me see what's happening there. Okay, Joshna. Hi, how are you? Mr. Haris, Lazala, Francis, Dua, Tayyaba, Shami, Ashraf, Aisha, Anuradha, Anas, Amna, Amy, Ahmed. You're all very welcome, doctors. All dear esteemed doctors, you're very welcome. And welcome to the journey towards passing part 2 written MRCPI, inshallah. All right, so this is a QR code. You can take a photo from your cameras. This is all the FAQs for the test reach are there in the QR code. I think we have a question or two in the chat. Hi, Ghazala. Hi, Joshna. And so again, revising, one paper, 100 single best answers, 3 hours, no negative marking, go for each and every one of them. So for the exam result, there's a 4 weeks waiting time. So for our exam diet, we'll go back over here. Let's see. So our exam results will be published provisionally on the 4th of April. So your exam date will be 6th of March, and your results will be published on 4th of April, 2025. Okay. So there's a 4 weeks waiting time. And for the written exam, the data files containing your answers are automatically verified, and they're put in the system to score against an answer key. And then the results, a lot of candidates ask me what way the results are tabulated. So there's a sort of a percentile system where the mathematical performance indicators are then calculated and scrutinized by the board to confirm the fairness of every question, and the pass mark is approved by the Board of Examiner for each examiner. So us as examiners, we are invited to a meeting of the board meeting where we are all confirming and signing that the result has been verified. Can you download all the Irish guidelines? Hi, Dr. Muhammad Umar. Absolutely, you can. And just wait for the next few slides. Just bear with me for a second. All righty. Okay. Now, so these are the preparatory resources. HSC, or the Health Service Executive Guidelines in Obstetrics and Gynecology. There are a lot of preparatory books that we will be giving you all the PDFs of, and all the SBAs will be discussed in a separate Telegram group. And we'll give you all the Green Top Guidelines summaries, Trainee Obstetrician and Gynecology summaries, FSRH summaries, and NICE guideline summaries. Okay, Joshna is asking a very important question. I'm going to answer this question in the very end of today's talk. Remind me, Dr. Joshna, who needs to sign the testimonial? All righty, okay. And these are your preparatory resources. There are 3 big hospitals in Dublin, Ireland. That's the Rotunda, the Coombs, and the National Maternity. And there is an Institute of Obstetrician and Gynecologist by the RCPI itself. Mary is heading the Institute of Obstetrician and Gynecologist, and she's a dear friend and colleague, and she is a permanent examiner for the Riyadh Center as well as the Oman Center, as well as the Abu Dhabi Center. Dr. Tayyaba Wasim. Hi, Dr. Tayyaba. How are you? Can you sign your testimonial from any of the consultants? You're from Pakistan. As I said, for the testimonial signature, I will answer all your queries in the end. For the testimonial, remind me. It's on me. I promise you. Okay, so this is the website for the IOG, and on their website also you have all the national clinical guidelines in obstetrics and gynecology. Everything is there on this website. And these are your SBA books. You do not need to copy anything today because the video of this talk is available today. And when you join our course, we are going to give you all these books, we promise you. So these are certain books for your SBAs that we talk about. Plus, on top of that, we are also going to do the recalls for 3 full days. So as I said, we will work together for all these tedious tasks with you on a daily basis in the Telegram group, as well as online on a rota basis. We usually do our sessions 6 p.m. Saudi time and 8 p.m. Pakistan and India time. So still, if you're confused about correct clinical knowledge, because some of you come from the MRCOG pathway, some of you are sitting both the examinations together, like me, I did the same as well back in my days. So let's do an Irish and UK guideline comparison, shall we? So let's say early pregnancy loss. So in terms of expectant management, outpatient management, surgical management, our Irish guideline says 2 weekly ultrasound. UK NICE guideline says for 7 to 14 days, urine PT at home and 3 weeks after miscarriage. Then outpatient medical management of early pregnancy loss, Irish guidelines says that the mean gestational sac diameter should be less than 50. And you can give misoprostol sublingually in 2 600 microgram doses 3 hours apart. Whereas the UK guideline says 200 milligram oral mifepristone, and 48 hours later, you give 800 microgram misoprostol. So see the subtle differences between the 2 guidelines. So we have captured each and everything for you in the classes so that you will be able to give the appropriate answer according to the Irish guidelines, wherever there is a comparison and wherever there is a subtle difference. Similarly, for surgical management, the Irish guideline says if the patient requests, or if there is heavy bleeding, or there is risk of infection, or there is gestational trophoblastic disease, or you're doing the suction curettage or ERPC. So, and the UK guidelines say do when clinically appropriate and do it as an MVA or manual vacuum aspiration in office or EVAC under GA. Okay. Similarly, for ectopic pregnancy, there's a subtle difference. for expected management, for medical management, for surgical management. So Irish guideline says 3 millimeters should be the ectopic, that this should be how big the ectopic should be. And the UK guideline says 3.5 millimeter. For expected management, Irish guideline says beta HCG of less than 1500, and UK is the same as well. The difference is in the mass. It should be less than 3 centimeter in Irish and less than 3.5 in the British guideline. And in terms of medical management, again, subtle difference. The main differences between the mass of the ectopic and surgical management is the same. All righty. Still worried about the recalls or SBA? Do you want to do a few SBAs? Do you want to do a few recalls? A woman who had breast cancer at the age of 45 now has severe osteoporosis of the head of femur at the age of 57. Which treatment is most suitable for her? Single best answer in the chat. Which treatment is most suitable for her? A, biphosphonate, B, calcium and vitamin D, C, raloxifene, D, tibolone. Okay, so Dr. Amna says it's C, Dr. Ghazala says it's AA. Okay, Dr. Mohammed, we do focus on Irish guidelines wherever there is provision, but however, if you read the Irish guidelines, most of them say, that they have, taken references from RCOG and Green Top guidelines and NICE as well. I hope that answers your question. Okay, so the answer to this one is A, biphosphonates. Okay, well done everybody who said A. Well done Dua, well done Shami, well done Tayyiba. Alrighty, okay. So because the other ones are supplements, raloxifene is a SERM, tibolone is a HRT. All right. A lady presents in the A&E at 36 weeks gestation with acute abdomen and vaginal bleeding. On an examination, she had a hard and tender uterus and fetal demise. What's the probable answer? Admit to HDU and observe, induction of labor, normal vaginal delivery, emergency C-section. What's the appropriate answer? D, E, all right. Anybody? Thanks, Lena. Thanks, Ghazala. Thanks, Dua. You guys are awesome, amazing. All of you are fit and awake. Well done. All right. So the answer is D, emergency cesarean section. Okay. So rest of them are all unsafe options. So see, that's how your clinical knowledge and judgment works against single best answer. They all may look, answers of choice, but you have to have the single best answer. That's the idea. Okay, another one. A 65-year-old lady presents with the gynae outpatient with postmenopausal bleeding, and a TV scan showed 12 millimeter endometrial thickness. She's on aspirin. What's the most likely risk for her? Is it a polyp? Is it medication-related bleeding? Does she have vaginitis or endometrial cancer? D. All right. Okay, everybody is happily saying D. All right, great. So all of the above are the risk, but most likely risk is CA endometrium. Great. Another one. A 29-year-old lady has been diagnosed prenatally with fetal omphalocele. She's being referred for amniocentesis. What information are you going to give her while counseling? Now, all might look good, but you need to choose one. It's done before 15 weeks. There's 1% risk of miscarriage. It's a screening test. Mosaicism can give false negative results. Single best answer, B. All right, okay. 1% risk of miscarriage, absolutely. All right, so 15 to 20 weeks or later. And it's not a screening test, it's a diagnostic test. And amniocentesis is done to detect mosaicism related abnormalities, okay? So again, despite that, we say, what if I fail? Why did I fail? What if I fail again? We all go through that, we all sort of sit down, procrastinate, reflect, then move on. We have a good day, we have a bad day. So the most important thing is your perseverance. Most important thing is that make a plan and go at least on a daily basis, if not like at least a few hours to start with, and then build up your stamina according to that afterwards. So you are making a difference every day, you know that, right? So we do crash recalls revisions. We also do confidence building and exam nerve calming sessions as well. Recalls will be included in this. Yes, Dr. Amna. Okay, so in order to succeed, our desire for success must be greater than our fear of failure. That's the most important thing for success. I will let you listen to what one of the recent trainees said who passed her exam.
Hello, good afternoon. I'm Dr. Nagla, Obligani specialist. I'm Egyptian doctor working in KSA. I have a good experience with med experts. I took the course for MRCPI-2 with Dr. Shazia and Dr. Tahira. Both of them were very cooperative with us, responding at any time, helping, and actually very good experience for me and ended nicely and successfully. Thank you for med expert and thank you for helping, cooperative, caring for everything. Thank you so much.
Okay, that was Dr. Najla. Well done, Dr. Najla. Congratulations. This is another testimonial.
I'm Dr. Komal, and I recently passed MRCPI written exam in September attempt. And for this purpose, I have joined med exam team expert. I am very thankful to the team and also the mentors, Dr. Shazia and Dr. Tahira, for their proper support and guidance. They made our concepts clear and carried out throughout the course. Particularly the theory workshop at the end of the session was very helpful for the SPs. Thank you so much. Alhamdulillah, I have passed my exam in first attempt.
And first attempt passing, yes.
Good for OSCE.
Excellent.
Thank you.
So Dr. Komal is now part of our OSCE group now for the next exam. And the most important thing is that the decision you're going to make today, my dear darlings, my dear candidates, my dear esteemed doctors, and all the study you're going to do now will be worth it in the end. And now with that, I have not forgotten the testimonial form for you guys. So the good news is if you can get it signed by any of your consultants, any two consultants that have been your mentors or that have been your referees, they can sign it for you. It does not necessarily has to be an MRCPI consultant. If you cannot find any, just send the PDF to me with your name clearly typed in the center where I showed you. I'll go back to it again. And then me and Dr. Tahira, one of our other mentors, will be more than happy to sign it for you. Okay. All right. That's the form. That's the testimonial form that's available on the website. When you will join our course, we will also give you a PDF of the form. You fill in your full name there in capital letters in black ink and then send it to us and we'll fill it in for you. No questions asked. It is for those people who cannot find referees or who cannot find any consultant to sign for them, who are not working or who are not in touch with their mentors. Okay. Any questions now? We are open for questions now. So my journey for MRCPI exam was a primitive one. I'm now the fellow of the college and I'm the examiner and the convener of the exam itself in Saudi Arabia. So in Saudi Arabia, we are doing the exam once every year. And then once a year, it is done in Oman and once a year it is done in Al Ain, Dubai. I'm talking about part 3 OSCE exam because this part 2 exam, as you know, is online. So you are all very welcome to join the course. Can you get training of Ops and Gynae in UK after clearing? Absolutely, Dr. Hina. Hi, how are you? Yes, you can. Now, on the basis of passing your MRCPI-2, then you will get an exemption from MRCOG-2. You can pass your MRCOG-3. That way, you do not need to sit for your PLAB and you can get training in obstetrics and gynae in the UK. That's one pathway. Okay. Any other questions? So then I passed my my MRCPI and my MRCOG both in the same year when I was working in Dublin, Ireland in the Rotunda Hospital. And from there, my journey is between Dublin and between London and then in Saudi Arabia, Riyadh. And so I'm a CCST consultant, certified trainer for IVF actually, but now I'm doing high-risk obstetrics and I do a lot of high-risk surgeries in both in obstetrics and gynecology, and I'm a trainer for minimal access surgeries as well. So what will be, okay, now question time. Excellent. All right, Dr. Amna Batul, what will be the course structure? Will you be given guidelines daily? Okay, very good question, Dr. Amna. The course runs on the Telegram group. We have 2 Telegram groups, one selectively for the SBAs where nobody talks, and the other one is where you will be given your mini schedules on a daily basis. And every day we will be talking about one or two of the guidelines. And then towards the end of the week, we will be talking about the same SBAs and same discussion online as well. So it will be your weekly revision as well. So the course structure is like that. Dr. Reem, I hope I answered your question as well, because yours and Amna's question were the same. Are you arranging daily basis video class discussion on Zoom or Telegram? Mr. Mohammed, Dr. Mohammed is asking. I believe I answered that as well, that the video is 2 times or 3 times in a week, and Telegram is on a daily basis. So depending on your structure of your plenary, the video, or which is the Zoom, will be probably twice a week or maximum 3 times a week. Dr. Tayyeba is doing MO ship in Ops and Gynae private setup, and your experience is more than 2 years, but from 2 different hospitals. You're eligible for part 2, and how you will mention your experience of 2. All they are asking, Dr. Tayyeba, is 9 months in Ops and 9 months in gynecology. So you can just make your testimonial according to that. Show me the testimonial. You can take my WhatsApp number from MedExam Expert. Show me your testimonial. So I will guide you how to write the language of the testimonial. All right, when the course will start? Okay, Anam, are you online, my dear? So you can put in on the details when the course is starting, darling. So Nazia, I hope to see you in the course then. I believe most of you are very dedicated professionals and you want to top your game with getting an international degree. And this is the time to make the right choice then. Okay, Dr. Reem is asking, will we need extra material other than the ones provided by you? Absolutely not, Dr. Reem, because we will be providing you all the materials. Okay, videos are recorded on website. Yes, Dr. Dua, videos are recorded on the website, and you will be given access to those videos within 24 hours of your online session. And I also make PDFs of the session. So like, you know, if you don't want to listen to the video, you'll have the PDF of the quiet session as well. All righty, okay. So good to see you. So how many of you are thinking of joining, so that I will make a note, and I will need to have your informal introduction as well, please. So do give us your WhatsApp numbers and do give us one passport size photo so we can make a database for you guys. And, you know, I mean, it's not that our exam courses are telling you to be too long in our course, because our motto is to prepare you and you pass your exam in the first go, inshallah. Okay, kindly give topic 1 day before discussion, because in morning we are absolutely, Dr. Mohammed, that's the plan. So we give you even 1 week ahead of time the topics for discussion, and then we discuss them in the group at a time that suits everybody. So we make a discussion usually late in the evening or after hours, like say for instance, any time between 9 and 10 p.m. or 10 or 11 p.m. But as the group decides, then we go according to the flow, and our mentors work according to that flow. Welcome, Dr. Ghazala. That's great. Welcome, Dr. Reem. That's great. Welcome, Dr. Tayyeba. That's great. I'm going to see you, and I'm sure me and Dr. Tahira and the whole MedExam Expert administrative team are great to have you guys on board, and we will be working day in and day out with you guys. You know, we are a tireless sort of a group, and we want you to be, you know, on your feet, on your tips all the time. And any questions, you can pester us day in and day out, and we'll be more than happy. Okay, are we to have our MRCOG1? No attestation, only for the MBBS degree. Dr. Francis, hi, how are you? Only for your main degree to be attested, my dear. Dr. Amna, welcome on board. Dr. Sabah, welcome on board. Dr. Nazia is asking, can she pass her exam in first attempt with infant baby? You are very busy, whole day with your baby, don't know how to manage. My darling, the most important thing is a big yes to that. A big yes to that. I remember when I passed my MRCPI in 2002, I had a small baby as well. And I believe my camera is open. I will try to open a photo and show to you how small the baby was, and for what FCPS degree should it be attested. Any degree, Dr. Muhammad, should be attested. Any degree that you have should be attested. That's important. It's only for the degree to be attested, nothing else. Okay. Let me show you. Just bear with me for 1 second. Okay. Can you see the camera? These were the 2 kids when I passed my exam. Can you see the camera? Okay, so we are all in the same boat. The basic thing is we are all in the same boat. We are no different. We all have our houses. We are multitasking. We are working. We are juggling work. We are sending the children to school. We are bringing them back from school and forth. And I remember, when I passed my MRCOG, I promised my kids I'm not going to study again. But within 1 month, I paid the fees for MRCPI, and my kids were very angry with me. What is this, Mama? You promised you're not going to study anymore. But now they cannot be more prouder. As time goes by, they understand how the career progresses, and apple doesn't fall far away from the tree. They're all doctors now, all three of them, and they're very happy that we took that course. So the Jazakallah khair, Dr. Nazia. Wa alaikum assalam wa rahmatullahi wa barakatuh, Dr. Sadia. You would like to request important point to be discussed daily and related SBA also. We do exactly that, Dr. Sadia. We discuss the PDFs for all the guidelines and the talks and the NICE in the Telegram group. There is a side-by-side Telegram group running, which is only doing the SBAs. You're finding the answers over there, and then you're discussing the answers with us if you feel that they maybe need a bit more explanation. And then we are also online practicing a lot of SBAs along with those revisions that you were doing. So within 1 week, you are you will be probably doing 3 or 4 topics or 4 or 5 topics completely and then moving on. Wa alaikum assalam wa rahmatullahi wa barakatuh, Dr. Ruqayya. Dr. Nazia, thank you so much. Jazakallah khair. It's just to give you all a moral boost up that nobody is different. We are all in the boat together. After passing MRCPI-2, can you go for MRCOG 3-2 without giving MRCOG 2? Okay, that's a very important question, Dr. Aisha. No, it's not interchangeable, darling. You have to do it the other way around. Please fix timing separately for guideline and SBA discussion for REs. Yes, Dr. Tayyaba. So when you have joined the course, when me and Dr. Tahira will sit with you, and we will fix your time separately for guidelines and sit your time separately for SBA discussion. That's exactly how the course runs. Telegram group, both the links, Dr. Omar. Okay, Miss Sabah, you're seeing all the questions and the queries, so you can send the Telegram link for both the groups. One for the main group and the other one for the SBA as well, guys. Okay. So we call those group Q banks, the Q banks. So please add all the new join candidates to the Q bank as well as the main written group for 2025. If we are busy at the time of discussion, yes. So you can follow it up, especially the Telegram. You can follow it up later. And for online, there's a recording available and a PDF available as well. I hope that answers your query, Dr. Ghazala. Okay, so any other questions, guys, before we close? Thank you very much. And it's good to catch up with all of you. If you have any questions, any further queries, just clarify them now, and then we will see you all in the group as well. All righty. So with this, I will take your leave now, and have a very good night, and we will see you soon in the Telegram groups. Dr. Ghazala, we will soon put down all the plenary for you, darling. All right. And I'm having a feeling that you'll be the first one to join the online sessions as well. So welcome on board. What time will be the daily discussion in SBA? Yes, we are going to make the plenary and put that in the group as well. And prayers for all of you to pass the exam in the first go. All righty. Okay. Good evening and goodbye for now. Thank you very much. Hi, Mr. Baraks. Okay, bye-bye. Thank you very much.